So looking at lifestyle choices, probably the most important factor in all of this is a female's age. In the UK, the average age of a menopause is 52, and I think perhaps a commonly accepted assumption is that your fertility just generally declines across the course of the years. But actually, there's a significant decrease in your fertility from your late 20s onwards, a steeper decline from the age of 35, and a very sharp loss of fertility beyond the age of 40. And that's seen in both natural conceptions as well as response to IVF treatment. Commensurate with increased age is also an increased risk of miscarriage, an increased risk of chromosomal abnormalities, such that by the age of 40, 1% of pregnancies have a risk of affecting by trisomy 21 or Down syndrome. However, the average age in the UK of IVF treatment is 35.1. Perhaps there's a health message that's already getting out there in terms of a female's age. But actually, if you look at the figures closer, almost 1 in 3 of those treatments are beyond the age of 37. When you look at IVF treatment success, there's different categories of data, and it becomes slightly perhaps confusing. So there's 3 terms that are talked about when we're looking at success rates and fertility rates in an IVF setting. The first of which is a pregnancy rate. That's just a positive pregnancy test following your treatment. The second is a clinical pregnancy rate, which relates to a first trimester ultrasound, which shows an intrauterine pregnancy with a fetal heart activity. And lastly, the live birth rate, the take-home baby rate. I think that's the one that couples are most interested in. So the most recent figures from the HFEA show that between the age of 18 and 34, you have a 32% live birth rate per fresh cycle using your own eggs. By the time you get to the age of 40 to 42, it's significantly decreased to 14%. And for the category age group of 43 to 44, it's gone down to 5%. But what I would also say, the caveat to that, is that different treatment centres have different success rates. And certainly, being quite frankly honest, we've never had a pregnancy rate in the over 42 category here in 9 Wales.